Hi, do you want to know what is the most valuable marker in your body to identify your sickness? That is present at least in 20 to 40% of the people. Valuable gift by the nature, present on your fingertips, non invasive means it doesn't include taking off any blood sample or putting any pipe or tube into your body. Least expensive but most neglected. Why? Because of ignorance. And ignorance is the root cause of all the difficulties. In my 14 years of holistic practice, none of my patients consulted me for their nail problems. Quite amazing. And usually, before starting my online video consultation, I ask for clear pictures of their nails. And at least 50% of them say they are polished, pedicured, or manicured. Please understand, there may be an important marker on your nail that points to your long standing sickness. Please try to understand that, and then you can go for whatever treatment you want. And simultaneously, I ask them, how are your nails? And the reaction is usually like this: 70% of people say they are normal. Very confidently, they say. But when I show them the deviations from the normal, their reaction is usually like this: 70% of them say they are not aware of it because because nobody asked about them in their lifetime. 10% presume that everybody has got similar patterns, and another 20% related to some injury. Yes, I agree that the present state of your nails may be initiated by injury, but please understand, body responds differently for each person depending on his constitution. Myself, Dr. Sudhakar Reddy Tirupati, pediatrician, with more than 30 years of experience in the modern medicine and 14 years of experience in homeopathy, which I call spiritual medicine, and little experience in Kundalini Yoga and acupuncture. You may find my mail ID interesting, Tryincurable. It doesn't mean that I cure every disease. No, definitely not. But thanks to the present state of the health situation of the people, I often succeed in 7 or 8 out of 10 people. And usually it doesn't include cancer patients because I did not study them. Okay, why should I know these designs? At least 20 to 40% of people have these patterns. Priceless gift by the nature, waiting there to be identified as marker of your sickness at least once in your lifetime. And if you really understand what I mean to say, my strong belief is that at least one member in your family or in your relation or in your circle will benefit. Okay, how does these nail markers help? These nail markers help in identifying your constitution. Nail markers are one of the many tools we use to identify the constitution. So let us understand what is constitution. Constitution includes all the characteristics of a person: physical build, mental makeup, likes, dislikes, his reaction to environment and situations. It also includes intellectual and emotional attributes. According to Paracelsus, Swiss physician and philosopher, no knowledge is perfect unless it includes understanding of the origin, that is the beginning. As all man diseases originate in his constitution, it is necessary that his constitution is known if we wish to understand his diseases. And constitution is one of the main tools to balance and maintain your health, to prevent sickness, and to fight diseases like COVID, whatever the strain may be. I repeat, main defense to fight diseases like COVID, whatever the strain may be. According to my experience, at least 70% of people have clear-cut constitution which points to single remedy. Okay, how does constitution helps in curing sickness? The constitution helps to find out a single remedy, at least in 70% of people, which not only rectifies most of these nail problems, also cures your long-standing sickness, long-standing health problems. Of course, it need not include lifestyle diseases like diabetes and hypertension. So, in essence, it is the cure of multiple diseases with single medicine, not multiple medicines for single disease. What is the proof that remedy based on constitution cured the sickness? The following nail markers are included in my study. only after confirming the curative effect of the remedy based on the constitution, and nail markers being one of the main tool to identify the constitution. And there is no speculation here. So let us understand what are these patterns and designs. If you basically understand four types of patterns, you almost understood 90% of the designs and markers. Basically, there are four groups as I said. To start with, there may be black skin around the nails as you can see in this picture, or there can be black nails, or a combination of these two. So you can see this black skin around the nails in this patient. Also, either middle-aged person with black skin around the nails. Then this is quite interesting. Nails of 11-year-old boy diagnosed as autism. I was discussing this patient with one dermatologist. He said that black skin around the nails is not related to autism. But I said this is related to the patient. That is the advantage. If you know the relation to the patient, most probably you will find the constitution and possible remedy which cures the problem. You can see this nails of again a 2.5-year-old boy who presented with constipation. Again you can see black color around the nails. Then coming to the second part, black nails and black skin around the nails. These are the nails of an young adult. He consulted me for baldness and habit of nail biting. One interesting thing I noticed here is he told me after 1 week of giving the remedy, his habit of nail biting reduced significantly. And it was a dream for him to grow the nails. That he says is possible now. Same thing is reported by another patient after 1 month. Though not completely, there is a significant reduction in the habit of nail biting. So I feel this is one of the strong indicator for constitution. These are the nails of either middle-aged women with black nails and black skin around the nails. Coming to the second group, ulcerated nails. See how clearly these ulcers are there. Ulcers, if you want to understand what is ulcer, if you see a break or a break in the continuation of the skin, we call it ulcer. And how does it apply to nail? Nail, usually you see the ulcer on the top or on the sides. So in this picture actually you can see not only ulcerated nails, corrugated nails, vertical corrugated nails. Then coming to the another examples of ulcerated nails, there are actually three types of nails of three people are there in this slide. On the right side you can see these 2 feet belong to one person. You can see the ulcerated nails. And the upper left corner of the picture you can see the black nails with white spots. This helped me to find out the remedy for his chronic problem of sciatica which was there since 15 years. It responded favorably in just 15 days. And down the left side you can see the nails of a 60-year-old woman with ulcers on the nails. And it again helped me to find out the remedy for a long-standing problem of redness in all the passages of her body. You can see another man, again ulcerated nails, see the vertical ridges, and they are very brittle. And one thing I want to stress in this slide is, see the last image, there is a cut in the skin of the toe, what we call chopped nails. The skin is chopped as if with a knife. This also again has got a lot of constitutional importance. Then see the nails of this man, 72-year-old person with thick nails, ulcers, yellow color, cracked. Another interesting thing about this man is you can see corns or callosities on the toes. You can see in the first picture how big they are. And after giving the constitutional remedy, you can see the change in the size of the nail and it has become almost painless. One thing I want to tell about this man, he consulted me when he was COVID positive. 72-year-old person with diabetes and hypertension, you can imagine the anxiety. So you see these symptoms, whatever these symptoms are there, they are in the sphere of his constitutional remedy. I don't know what others will understand, particularly eyes of one eye, left eye, and a lump in the throat. Imagine the anxiety in a COVID patient with the lump in the throat feeling. All these symptoms helped me to find out the constitutional remedy which I just gave and helped him fast recovery in just 4 days. I studied many cases of constitutional remedy in COVID cases. And my experience is constitutional remedy is a powerful defense against COVID. And this article is published in this journal. If somebody is interested, they can go through. So let us understand third major group, brittle or soft nails. Brittle nails means some people have nails. If you apply pressure, they bend just like that. Or the nail comes off in layers, or it comes off in powder form or in chunks. That is what is brittle nail. You can see in this picture how the nail is exfoliated on the top, forming a nice design, and you can also see white spots on the nails. See these nails, how brittle they are. Not only brittle nails, you can see yellow spots on the nails, and these yellow spots I want to stress, you don't see a nail totally yellow polish, no. Either usually at the edges or on the top or at one side. I can see, as you can see in the second toe, yellow color. So another feature in this man is see the elevated nails. It is always elevated, breaks off whenever he touches something, he gets so much of pain. So as a precaution, always he cuts the nails in advance. So this is elevated nails. This is another example of brittle nails. Actually, I asked that woman why this nail on the big toe is cut. She says they are very soft. I just take it out with my fingers. See the brittleness, yellow color and white spot. Anybody who understands constitution can easily find out the remedy. These are again brittle and soft nails. You can see the brown color also, brown and so brittle that it falls off like cards. So that is the understanding of brittle nails. Then coming to the fourth group, colored nails. In my experience, the most common colors I see are black and yellow. And next comes blue color, but blue color I don't include blue color associated with what we call cyanosis or clubbing. That is not included in this. You can also see livid brown, white and purple colors. You can all see the examples in my slides. These are the brown nails of a 60-year-old woman. As I said, you can see the brown nails with yellow tinge at the edge of the nail. And below left corner, they are the brown nails of another woman. Then coming to the purple nails. These are the nails of an young girl. Purple nails with horizontal striations. Both have a lot of importance in finding out the remedy. Actually, that remedy helped her in curing her long-standing problem of pain, abdomen and headache. On the right side, you can see white nails. Don't confuse white nails with pale nails. Pale nails, pinkish only, but pale. But what you see in this series, white nails, they are seen usually in a chronic disease like kidney failure. This patient actually received kidney transplant. So those are the nails. The next is ivory nails, bluish gray. This woman consulted me for swelling of the feet, and definitely again this helped me in finding out the constitutional remedy. So let us see the change. Does the constitutional remedy have any effect on these deviations or abnormalities of the nails? See, these are the nails of a middle-aged man who consulted me when he was COVID positive. And again, I am stressing here, he presented with symptoms only which are there in his realm of his constitutional remedy. That helped him in fast recovery. See the second nail, how dark it is, and you see the effect after giving the constitutional remedy. Again, same person's nail, yellow color nail, changed after giving the constitutional remedy. Coming to the next patient's nail, this I like very much because you can see the black color, more than black color, you can see the deep cleft in the nail. And after giving the constitutional remedy in a matter of just 15 months, just see how much it has changed. Honestly, I do not know any other remedy other than constitutional remedy which can bring so much of change in the nail structure. If somebody knows some medicine which can have so much of effect on the nails, I am interested to learn. And imagine when a constitutional remedy affects so much on the nails, how much effect it can have on the soft tissues and other organs of the body. Then these are the nails of a middle-aged woman who had chronic menstrual problems. See the black color of the nails and black skin around the nails and how it has changed after giving the remedy. Again, these are the hand nails of the same woman. You can see after giving the constitutional remedy, how it has changed. Another woman with black nails changed after remedy. These are the nails of an young adult with psoriasis. See how clearly the black color around the nails is seen and how it has changed after giving the remedy. Again, these are the nails of the same person changed after giving the constitution remedy. Nails of another psoriasis patient. One is very interesting thing in this is see the color. In the middle picture, you can see actually the pink color down and yellow color on the top, what we call half and half nails. And after giving the constitutional remedy, you can see how clearly it has changed. Not only the nail, his disease also has improved. These are the ulcerated nails with corns. See the black nails with white spots and corns around. When you see the same nails from the side, this is how they look. Actually, he was taking treatment for his corns since 2016. Many antibiotics were given, antifungal agents were given, and even surgery was done. That mass was cut, which has become worse after treatment. He consulted me in 2019 with these complaints, and after seeing the improvement in all of his complaints, he received the treatment for the corns also. Then you can see the change how nicely he has improved after giving the constitutional remedy. He also had white eruptions under the toes, which is very common condition. Usually it doesn't respond to many medicines. See how it has changed after giving the constitutional remedy. Of course, these nails belong to another person, but what I want to stress is see the white eruptions between the toes. Very commonly seen, doesn't respond to most of the treatments, responds very well to constitutional medicine. These are the ulcerated nails in another person. You can see clearly the ulcer on the side of the nail and how nicely it has improved after giving the remedy and how strong it has become. Again, ulcerated nails of young women with chronic cough in childhood. Not only cough improved, you can see the change in the nails after giving the constitutional remedy. And you can also see yellow discoloration of the nails which has changed after giving the remedy. Coming to the third group, brittle nails. See how brittle these nails are, very transparent, easily breakable. See the change after giving the constitutional remedy. How stronger they have become, how beautiful they are. Not only I want to polish, I want to put some designs on them. They are either brittle nails of another middle-aged woman, how they have changed after giving the remedy, you can see. Same woman had ulcers on the side of the nail, which has disappeared after the remedy. These are the brittle nails also showing blue color. Same after treatment, it has disappeared. There is one more constitutional thing about the nails. If you see some dead tissue around the nails, dead cuticle, what we call hang nails, you can see in this man in the first picture, hang nails, how they have changed after giving the remedy. And he also had curved nails. Coming to the next group, spotted nails. You can see clear white spots on the nails, usually linked to the calcium deficiency, need not be. These are the nails of young women with PCOD with irregular menstruations. In the next image also, you can see the spots on the nails, again same problem, PCOD with irregular menstruations. On the left side, young boy with a white spot on the nails. This is another common condition, paronychia, what we call. That means infection or inflammation around the nails. Many people get it very frequently, keep on putting on antibiotics, but they keep on recurring, but usually not after constitutional remedy. These nails belong to middle-aged women. You can see the nails, black colored nails, but they are going in the wrong direction, what we call ingrowing toenails. Most of them, they go for surgery, but they keep on recurring, but never after constitutional remedy. You may ask me, I see a lot of causes of nails on internet. What are they? Yes, it is good to know, but most of them are known to the doctors. Most of the reasons are known to the doctors. But particularly, don't neglect them, which I have shown in the red marks. They are very important. You have to consult the doctor immediately, particularly if you see a nail which is concave upwards, usually indicates iron deficiency, or what we call clubbing with convexity upwards, usually associated with blue color or cyanosis. Don't neglect. And if you see any black patch on your nails, particularly if it is recent one and changing in color and intensity, don't neglect. Consult the doctor. What is more interesting to me is this idiopathic group. This idiopathic comes from the Greek. Idios means one's own. Said very correctly, one's own. Pathic means A form that suggests effects of disease. Yes, that is the defects of one owner, means disease of the owner. Once you study the owner, usually it is no more idiopathic. It is as simple as that. So it is the disease of the owner. So understand the owner. That's as simple as that. Finally, I have a disclaimer to make. This presentation is not intended for any therapeutic purpose. And if you have any of the nail markers or designs which I mentioned, please consult a medical professional who understands these patterns. That is very important. Finally, I want to thank all my patients, particularly women who sacrificed their nail paint and responded promptly to my call and sent their recent nail pictures. Thank all of you, and thank you also. See you in my next video. Thank you.